So, very good day to one and all. I am Dr. Rohit Gopinath, and today I'll be talking about an important topic, namely peripheral nerves. Now, as far as a surgeon is concerned, peripheral nerves are of interest in surgeons because of possible palsies and injuries that occur to them. So, to understand and to manage a case of peripheral nerve palsy or a peripheral nerve injury, it is very much essential that we have a basic understanding regarding a cross-sectional anatomy of the nerve as well as how a nerve regenerates. Because understanding the anatomy as well as understanding how a nerve regenerates will help us in identifying disease conditions which have a poor prognosis and can also help us prognosticate and improve surgical results while operating on patients with nerve palsies. Now, so first let's discuss regarding the cross-sectional anatomy of a peripheral nerve. So if you cut a peripheral nerve, like how you would cut an onion, so what you see on the cut surface is that it has an outer layer, outer lining, which is called as an epineurium. And within the nerve, peripheral nerve itself, you have multiple fascicles or fasciculus, each of which is called, and they are called fasciculi in plural form. And these fasciculi or fasciculus, this fasciculus is covered over by what is called as a perineurium. Within the fasciculus are the axons of the nerve fibers, and these are covered over by the endoneurium. And deep to the endoneurium is an inner lamina of Schwann cells. To summarize again, a cross-sectional image of a peripheral nerve will show us that it has an outer lining which is called as an epineurium, as shown here, and the nerve as such contains multiple fasciculi or fasciculus singular. If you say singular, it's fasciculus. And each fasciculus has an outer covering which is called as a perineurium, and the fasciculus itself is made up of a lot of axons and it is covered over by what is called as an endoneurium, and deep to the endoneurium is the inner lamina of Schwann cells. So with this basic understanding regarding the cross-sectional anatomy of the nerve, we can now proceed towards understanding how a nerve regenerates. Now, we find that nerves in the peripheral nervous system are unique in the fact that they undergo a process of degeneration prior to regeneration. So this degenerative process is called Wallerian degeneration. Now, it occurs when you have a complete injury to a nerve, say a total transection of the nerve fiber, then it tends to proceed towards Wallerian degeneration. So what exactly is Wallerian degeneration? Now, to understand Wallerian degeneration, we should know that there are two aspects to an injured nerve. You have a proximal injured nerve as well as you have a distal component of an injured nerve. Now, the changes in Wallerian degeneration are predominantly in the distal component of the injured nerve. In the distal component of the injured nerve, the axons go in for demyelination and degeneration. So, the axons demyelinate and then they break down. So what happens along with that is that because there's breakdown of a lot of axons distally, these are infiltrated local tissues are infiltrated by macrophages which engulf these breakdown products of axons and clear them away. So once the axonal degradation products are cleared away, then Schwann cells tend to proliferate in anticipation of new nerve fibers which might be coming in from the proximal end of the nerve. So in the proximal end of the nerve, what happens? So in the proximal end of the nerve, two important changes happen. One is that the nucleus, which is centrally placed, as you can see in a normal nerve fiber, becomes peripherally placed. And also there's breakdown or lysis of Nissl substances or Nissl corpuscles within the cell body of the nerve. So this process is called as chromatolysis. So once this Wallerian degeneration has occurred, then what happens is that in the proximal end of the transected nerve, there occurs what is called as the growth cone. So this growth cone gives rise to multiple neurofibers, and these neurofibers proliferate and propagate themselves or elongate themselves towards the distal end to communicate with another nerve fiber. This propagation or development of neurofibers from the growth cone is facilitated by the Schwann cells by producing a lot of substances called neurotrophic substances. So Schwann cells, which are seen in the peripheral nervous system, are essential for nerve regeneration to occur. So your nerves in the peripheral nervous system are unique in the fact that they undergo degeneration first, followed by regeneration.